seen in the future, Francis.
And hopefully it'll stay negative even after that quarantine. NBC's Sarah Daloff, thank you so much. Joining me now to sort through the latest with Ebola is Dr. Frank S., infectious disease specialist at University Hospitals of Cleveland. We appreciate your time this afternoon, especially with so much fear here in New York as well. Let's start with here. The CDC is using his credit card and subway card to help trace Dr. Spencer's movements here. So at what point will the city be kind of in the clear, especially if you have the bowling alley tweeting out a message, kind of humorous message saying that they're okay, but at what point will all the other places be in the clear as well?
You know, with Dr. Spencer coming back to New York, he only recently developed symptoms. And the one thing about the Ebola virus is that when you just first start feeling ill, you're not very infectious. And when he realized he was coming ill, he worked with the city, he worked with the state health department, and he got himself into quarantine such that the exposure was very, very minimal. I have a feeling that the city itself is in the clear for the most part because the exposure itself was not very intense. When you look at all the people who've had Ebola, they're really people who are returning from Africa, missionaries, doctors like himself, or the people who were caring for very stricken Ebola patients here in the United States, the two nurses from Dallas. The regular public are not really the people who are coming down with the disease. It's really the healthcare workers themselves.
So you're saying the city, okay, it should be fine. Go about your business. No need to go freaking out or not take the subway when it comes to this. So that should be reassuring, as well as the United States is 7 for 7 when it comes to treating Ebola patients. That should ease some fears as well.
Well, listen, Ebola will kill individuals even with the best care available. We think we do a much better job here, which is one of the reasons why we have brought American citizens who are stricken with the disease in West Africa, and we would bring them here for our medical experts to help them out. But we have to give this disease the respect that it deserves. Even under the best circumstances, there will be people who will die from Ebola. Just a very, very severe disease.
We also have to consider these new quarantine rules, especially after 3 states have adopted them. And there is concern it's going to keep volunteers from going to West Africa. In fact, take a listen to what Dr. Rick Saker had to say about this.
The big thing that's going to help America be safe against Ebola is when we get the epidemic in West Africa under control. We need to find ways to encourage more people to go and not make the situation too burdensome for them on their return.
All right. So do you think that's the case that, we should follow suit with other states as well, or federally there should be some kind of, quarantine rule across the board?
Well, I want to agree 100% with what he said. The threat to the United States is the disease in Africa. And so long as that outbreak rages, we will continue to see people who will either come back to this country because they went there to help, or there will be travelers themselves who will then enter this country unannounced or at least unexpected, and they will fall a victim to this virus. They will become symptomatic. The main focus of our efforts needs to be in controlling the epidemic in West Africa, as well as being prepared here at home for anyone who shows up with those symptoms.
Well, Dr. Esper, I want you to put this in perspective in this sense, to ease some more people's minds here. Your flu season is coming up. It's peaking in December. So compared to Ebola, here's the scenario. You're in a cab, or you're, at a restaurant near somebody, you're at a church, whatever. Somebody has Ebola, and then somebody who has the flu. Which one are you more likely to get?
No doubt it would be the influenza. The influenza virus is just a different tier of infectiousness compared to Ebola. 10, 100 times more infectious. When you talk about how contagious a virus is, it depends on how many virus particles are required and how easily are they spread from one person to the next. And influenza, there's just really no stopping influenza. We aren't able to quarantine off influenza like we are with Ebola. When influenza hits, it goes throughout this country and every country around the world. There's no stopping it. That is a true respiratory disease.
Sure.
Whereas with Ebola, it really, really requires prolonged, intimate contact, the contact that we give as being a healthcare provider to a very stricken patient.
And I think that's what scared people is knowing, wait a second, these healthcare providers, they go through painstaking efforts with a hazmat outfits and everything to sanitize, yet they are still the ones who have contracted Ebola, tested positive for Ebola. And I think that's what's so scary for so many people. But when you break it down in that sense, hopefully those fears will be eased even in just the littlest sense. Dr. Esper, thank you again for that.
Very good to be here, Francis.
President Obama is commending New York City for its handling of